The symptoms for uncomplicated malaria are fever, chills, rigor, sweating, headache, generalized body and joint pain, nausea or vomiting, loss of appetite, abdominal pain, especially in children, irritability and refusal to feed. That's in infants. The signs that are usually elicited are fever, mild pallor, mild jaundice, splenomegaly. Investigations are microscopy, thick and thin blood films for malaria parasites, rapid diagnostic test, FBC, and other tests as indicated. The main treatment objectives are to avoid progression to severe malaria, to limit the duration of the illness, to minimize the development of drug-resistant parasites. Non-pharmacological treatment in children, typically sponging to reduce blood and body temperature. The pharmacological treatment, the first-line treatment, to give artesunate amodiaquine oral or artemether-lumefantrine oral or dihydroartemisinin piperacin oral. So let's look at the formulations. For artesunate amodiaquine co-blistered formulation, the regimen for once daily dosing. For weight, 5 to 10 kilograms and age less than 1 year, you give half day 1, half day 2, half, and day 3 half of artesunate 50 milligrams tablets, and day 1 half, day 2 half, and day 3 half for amodiaquine as 150 milligrams base tablets. And for 11 to 24 kilograms weight, age 1 to 6 years, you give 1 day 1, 1 day 2, 1 day 3. Also, for the artesunate 50 milligrams tablets, the same for amodiaquine 150 milligrams base tablets. And for 24 to 50 kilograms, 7 to 13 years, you give 2 tablets for days 1, 2, 3 for both artesunate 50 milligrams tablets and amodiaquine 150 milligrams base tablets. And for 50 to 70 kilograms, 14 to 18 years, give 3 for artesunate 50 milligrams tablets days 1 to 3 and amodiaquine 150 milligrams base tablets. And more than 70 kilograms, age more than 18 years, you give from days 1 to 3 for both artesunate 50 milligrams tablets and amodiaquine 150 milligrams base tablets. So those in milligrams per body weight is amodiaquine 10 milligrams per kilogram plus artesunate 4 milligrams per kilogram, taken as a single dose daily for 3 days after meals. Let's look at artesunate amodiaquine co-blistered formulation, the regimen for twice daily dosing. So for 5 to 10 kilograms with age less than 1 year, you give 1/4 of both medications, artesunate 50 milligrams tablets and amodiaquine 150 milligrams base tablets throughout days 1 to 3, and from 11 to 24 kilograms for 11 to 24 kilograms and with age 1 to 6 years, you give half from day 1 to day 3, That's for both artesunate 50 milligrams tablets and amodiaquine 150 base tablets. And for 24 to 50 kilograms, 7 to 13 years, give one throughout. And for 50 to 70 kilograms, 14 to 18 years, you give 1.5 throughout. And more than 70 kilograms, with age more than 18 years, you give 2 throughout, as 2 of artesunate 50 milligrams tablets to amodiaquine 150 milligrams base tablets from days 1 to day 3. So artesunate and amodiaquine phased dose combination, the standard regimen using the 3 available dosing strength. So for weight less than 8 kilograms and age 2 to 11 months, the tablet dosing strength and artesunate, that's AS 25 milligrams, amodiaquine, that's AQ 67.5 milligrams, and you give 1 day 1, 1 day 2, 1 day 3. So that's 2 to 11 months, but for 9 to 17 kilograms in 1 to 5 years, you give artesunate 50 milligrams, amodiaquine 135 milligrams, and you give 1 shot. And for 18 to 35 kilograms, 6 to 13 years, artesunate 100 milligrams, amodiaquine 270 milligrams, give 1 shot. More than 36 kilograms, more than 13 years, give artesunate 100 milligrams, amodiaquine 270 milligrams, 2 shots. So each phase dose combination tablet contains both artesunate and amodiaquine at the doses indicated, and the product packaging clearly indicates which dosing strength applies to which age group. The maximum daily dose of artesunate and amodiaquine is 200 milligrams per 600 milligrams. So let's look at artemether lumefantrine dosing regimen. We will look at the combination artemether 20 milligrams plus lumefantrine 120 milligrams, and then the number of tablets to be given. So less than 5 kilograms, less than 5 months, it's not recommended. It's not recommended for patients under 5 kilograms. At 5 to 15 kilograms, at 6 months to 1 year, you give 1 tablet throughout days 1 to 3. So first dose, and you give second dose after 8 hours. The second, they give 1 dose in the morning, the next in the evening. Third day, 1 dose in the morning, the next in the evening. The same applies to all, but the dosages increases. So for 15 to 25 kilograms, that's 3 to 8 years, you give 2. That's the number of tablets to be given through days 1 to 3. And 25 to 35 kilograms, 8 to 12 years, you give 3. And more than 35 kilograms, as more than 12 years, you give 4. Let's look at hydroartemisinin piperaquine dosing regimen. So for 5 to 10 kilograms, age less than 1 year, day 1, you give 1 quarter, day 2, 1 quarter, day 3, 1 quarter. So dihydroartemisinin is 40 milligrams, piperaquine 320 milligrams base. Okay, so for 11 to 15 kilograms, as 1 to 3 years, you give half throughout. And 16 to 24 kilograms, that's 4 to 6 years, you give 1 throughout, so through days 1 to 3. And 24 to 35 kilograms, that's 7 to 10 years, you give 1 quarter. So you give 1 and a quarter, days 1, day 2 and 3. And for 36 to 50 kilograms, that's 11 to 13 years, you give 1.5 throughout. So for 50 to 70 kilograms, that's 14 to 18 years, give 2 throughout. And more than 70 kilograms, that's more than 18 years, give 3. Day 1, 3, day 2, but day 3 you give 2.